And now to Ibadan, where the Chief Medical Director, University College Hospital, Ibadan, Professor Jesse Otegbayo, has described shortage of manpower in the health sector in Nigeria, calling on the government to intervene before the situation degenerates. Speaking during the inauguration of the Special Duties Unit in the hospital, Professor Otegbayo says the total number of caregivers on ground are grossly inadequate to the number of Nigerians seeking medical attention on a daily basis. Correspondent Kunle-Jo reports that the Chief Medical Director of the hospital declared that the management decided to float the Special Duties Unit in order to bridge the gap of inadequate manpower noticed in the college hospital. On a part, Dr. Patricia Onimwa, Director of Nursing Head Clinical Nurse in UCH, commended the management for the initiative, noting that it would bring a sort of relief to both the hospital and the management.
Federal receipt will just come and jump them and drive away. No money, nothing, nothing. Even there, sometimes if they are points, don't know their identity. But some know their identity and they have money. But no relative, maybe some of them are traveling to the north and they had accident there. I mean, where do they get relations? And they have money. Forget about those who are indigent who don't have money. Some have money, but they can't move around. And how many can nurses do to assist, or health attendants? You will be overwhelmed. And of course, like it's well known in Oklahoma now, we are also actively short-staffed.
The initiative, the patient health care, the patient health initiative, helper initiative has actually, I would say it has, to some extent, it has worked, particularly now that we have shortage on the wards. But even with that, we still hope that by the time the system becomes buoyant in terms of nursing staff, they will be able to, patient care services will be better for it.
Professor Tegbayo, however, solicited the support and cooperation of all staff of the hospital for the lofty idea, noting that on many occasions, patients have been abandoned in the hospital by their relatives as well as other rescue teams. The foundation head of the Special Duties Unit, Professor Omolola Atalabi, says all hands will be on the deck towards enhancing the quality of care for the patient in the hospital.
These are people that will help some of our patients who are immobilized on the ward to assist them to do some errand work. There are some patients that we admit that don't have relatives or anybody to help them, either to get one material or the other. Like sometimes we have patients that are brought maybe from Lagos by an expressway who are traveling to the north and they will have accidents. Road safety will bring them. They don't know anybody, they don't have anybody. And there are certain needs that our nurses, our health attendants may not be able to meet. For this, helpers, we call them patient helpers.
We know that government cannot do everything, but I would advise that in this era of JAPA, we've lost so many medical teams, not doctors, nurses, lab, pharmacy, everybody. We are so short. In the wards now, you can hardly have a ward of like 20, 25 patients with 2 nurses. You can hardly have it.